So coming to the gender affirmative surgery, again, not everybody, all trans people would like to undergo the gender affirmative surgery. It has to be seen as an option. So this, so again, like it is the WPATH guidelines which we need to look at. Even though the WPATH guidelines is based on gender dysphoria, so I'm using the gender incongruence here because that is more relatively appropriate, and then it is going to be implemented in 1 year from now, and already everybody is using this terminology, and uh, we- which is non-stigmatizing to trans people. So these are some of the criteria which need to be satisfied before we offer the surgery, satisfying the diagnostic criteria of gender incongruence. And of course, I'm talking about the adults. So the person should be a legal major and ability to provide informed consent. Uh, providing surgery for transgender adolescents is, uh, of course, it's that will take a lot of time for me to discuss. So I will restrict myself to gender affirmative surgery in adults. So of course, before surgery, there should be adequate counseling about surgery and what will be the uh, say negative outcomes in such in some for example, what are the risks associated with that, and what are the positive outcomes both in terms of the physical appearance and also in relation to the mental health. All these should be explained to the person, just like any other surgery, major surgery, and a written informed consent should be obtained. Of course, after surgery, there should be post-operative counseling and adequate post-operative care. So what I have seen is often if because in some government hospitals in Chennai, they also offer this gender affirmative surgery. Most often, people may not want to come back for the follow-up care. Of course, it is also the responsibility of the surgeons to emphasize the importance of the post-operative care. For example, if the person has undergone, say, vaginoplasty, if the person does not come back, unless there is some dilatation of the new vagina. So it may actually close, or there may be post-operative complications in relation to the gender affirmative surgery, uh, which may occur. So if the person is not going to come back for screening after a month or so, for example. So these are some of the things which need to be done. So not before surgery, counseling, after surgery, counseling, and proper post-operative care. So what are some of the surgeries which are available for trans feminine persons? So in India, I think what I have seen is the commonly uh, because many hijras, they may not able to afford uh, paying money to, say, a qualified plastic surgeon. Most often they may go to quacks. So mainly those quacks, they may not be even have completed MBBS. They offer uh, surgery, which is mainly removal of the male external genitalia, removal of both I'm talking about the sages, the trans feminine persons. So where they may remove the penis as well as the testes. So they may not, the quacks, they may not able to construct the new vagina. Uh, but nowadays, uh, there are transgender women who are also coming from middle class background and upper class background. And some of the hijras, even though they are from the lower socioeconomic status background, they actually save money, enough money through sex work or other means so that they can afford, they can able to afford these uh, surgeries by the plastic surgeon. So the first three are the common surgeries which are which are undergone by trans feminine people. The clitoroplasty and vulvoplasty are also done, but that is relatively rarely done because of the expenses. In relation to the breast surgery, some people may be comfortable with the breast changes because of the hormonal therapy, but some people, they may also want to have say a silicone implant or a saline implant, or they may want augmentation surgery by transplanting muscles from somewhere to the breast area. So these are some of the surgical operation for augmentation mammoplasty. The third one I have listed is done relatively very rarely in India because of the lack of expertise here. So most of those are available primarily in, of course, people here from India, many of them, they go to Thailand also because there are many uh, surgeons, many surgeons who are specialized in surgery among transgender people. They offer these kind of surgeries. So just to give an idea about what will be the cost of some of these surgeries. So this is actually from one of the studies I was associated with, but some of these costs are, I think, almost the same even now. It was in 2014, but again, the same thing may be applicable even now, or maybe if not a little bit higher than this, depending upon the type of hospital. So here it is. It is among the corporate hospitals I'm talking about. So for the facial hair removal treatment by electrolysis or laser therapy, it can be 2,500 rupees per session. And for female hormonal therapy for trans women, it is relatively cheaper because it is similar to oral contraceptive pills, so it is not that much costly. For breast implants, for example, in Tamil Nadu, in the government hospital, if we can able to buy a breast implant and provide that to the government provider, they usually do the surgery for free. But usually the implant cost at least around 20,000 to 30,000. So that is again like it has to be borne by the uh, transgender people themselves here, even in Chennai, where they provide some free gender affirmative surgery in some government hospitals. Of course, depending upon the corporate hospital, they may charge anywhere from 60,000 rupees up to 1.3 to 1.5 lakh rupees for the neovagina creation and vulvoplasty, clitoroplasty, depending upon the type of surgery they want, the amount may vary. We discussed about the gender affirmative surgery for trans women, but for trans masculine person, of course, one is the uh, uh, chest reconstruction or what they call masculine chest reconstruction. So removal of the breast so that the chest can be masculinized. So that is one common thing which even in India, many trans men, they are opting for this because this is what they refer to as a top surgery. So the bottom surgery is more difficult. So we don't have much expertise in India to do this bottom surgery, except maybe for the first one, the hysterectomy, salpingo-oophorectomy, and vaginectomy. This can be done by any trained surgeon or gynecologist. But the penile and scrotal reconstruction, that requires some expertise. Because of the lack of expertise on this construction of male external genitalia in a trans masculine person, many people they find it difficult to undergo this surgery, even though they may want to. Okay. Again, I know of only like one or two government hospitals, they have offered this bottom surgery. For example, I know one person has undergone the bottom surgery, including the uh, reconstruction, the construction of the male genitalia from AIMS, for example. Again, it depends upon the doctors who are there. The doctors, if the doctors leave the particular hospital, it may no longer be available. So even though I mentioned the AIMS, like if a particular doctor leaves the AIMS, then that may no longer be available in AIMS. Okay, so I think, yeah, this is just to show you like only a very few government hospitals, they offer gender affirmative surgery or hormonal therapy. I have listed some. So for example, in Raipur, Chhattisgarh, there was an initiation of gender clinic. In Chennai and Madurai government hospitals, some of the government hospitals, they provide uh, gender affirmative surgery. And again, one hospital from Cuttack. And some of you might have heard about like Kerala government has announced reimbursement of cost for gender affirmative surgery. Um, Again, in terms of the insurance coverage, only very few insurance providers, they reimburse cost of the hormonal therapy, and I'm not sure like whether anybody reimburses cost of the gender affirmative surgery. But in the recent Transgender Protections Act, actually the act and the rules, they actually mandate the government to provide free gender affirmative surgery and hormonal therapy in line with the WPATH guidelines. And it also recommends I will not say recommend, it also directs the government to provide a comprehensive insurance, health insurance for transgender people. So if that is implemented, I think then hormonal therapy and gender affirmative surgery may also be covered both under the government health insurance and also under the private corporate health insurance. Yeah, I think that's it about the very briefly about the gender transition, both hormonal therapy and gender affirmative surgery.